Good morning. Today we're going to discuss the Spanish flu pandemic from 1918 to 1919. To start, I wanted to provide a comparison of global deaths from previous influenza pandemics in the last century. The 1918 to 1919 Spanish flu pandemic had over 50 million, possibly up to 100 million deaths. The 1957 to 58 Asian flu pandemic had up to 2 million deaths. The 1968 to 70 Hong Kong flu pandemic had up to 2 million deaths. And in 2009, the swine flu pandemic had up to 284,000 deaths. The Spanish flu was understood a little bit differently in 1918. Although germ theory was well established and we were able to microscopically identify influenza, we thought it was a bacteria and called it the influenza of Pfeiffer. We did, however, understand that it was spread from secretions of infected persons or carriers. So when they didn't cover sneezes or coughs, when you came in direct contact with them, or indirectly with the secretions that had landed on other surfaces. We understood the incubation period before the onset of symptoms to be between 1 to 4 days. Today, we understand that it is a bird flu, an avian influenza that can spread from birds to humans and vice versa, and it is an RNA virus of the subtype H5N1 that causes an acute respiratory infection. We know that the spread is the same via contact with secretions of an infected person, either directly or indirectly, and we believe that the incubation period is very short, only 1 to 2 days before symptoms appear. Preventing the spread of influenza has changed a little since 1918. We did recommend isolating the sick, avoiding crowded public places such as trains and subways, improving personal hygiene practices, and strict quarantine, however, was not suggested as they didn't believe that it was effective. Although vaccines were available, they were not believed to be effective, so were not consistently used. And then lastly, protective equipment such as masks and gowns were recommended for healthcare workers. Today, we still recommend isolation from the sick, hand washing or the use of hand sanitizer, social distancing, so avoiding crowded public places still, and personal protective equipment for healthcare workers. But our primary method of preventing the spread of influenza is through vaccines, which are recommended for ages 6 months and up. There has been some changes in the way that the disease was defined. Aside from the change from it being a bacteria to now us knowing that it is a virus, the symptoms remain generally the same: bodily weakness, aches, fever between 100 and 104, but with a low pulse, which we know now is just a fever over 100.4, headache, cough, runny nose, sometimes vomiting and diarrhea, which we know nowadays may accompany the flu, sweating, chills, inflamed eyes, nose, throat, and bronchi. And today we have identified it to be more of a dry cough that's associated with flu. Diagnosis in 1918 was confirmed through clinical symptoms and could be done through bacterial identification. However, it was not as easily readily available or easily done at that time. Diagnosis today, following the presentation of clinical symptoms, is confirmed using rapid polymerase chain reaction, a genetic test, or by culturing the virus, although that's less used since it's quite a bit slower. Treatments for the disease have changed a bit in the medical community. In 1918, fresh air, abundant foods, Dover powders for pain, and bed rest was recommended until the fever subsided. Some countries even utilize quinine, which actually is part of malaria treatment today. Now, we have antivirals such as Tamiflu that help lessen the symptoms if you can catch it within the first 24 to 48 hours after symptoms start. They still recommend rest until fever subsides, plenty of fluids, anti-inflammatory drugs if needed to help with pain and fever, and cough suppressants as well. Pharmaceutical regulation in 1918 was not as present as it is today. So items like these mentopene cough drops stated that they could keep the flu away if taken consistently. Of course, these were claims that were not verified by research, but there were multiple medications that were being marketed at the time to prevent flu. The disease has been viewed within society a bit differently. At the time of the 1918 Spanish flu pandemic, it is suggested that there was limited sharing of information on the pandemic due to the war propaganda efforts. The reason that it became known as the Spanish flu is because one of the first countries to report it as an epidemic was Spain. But, for example, Spain was told everyone that it was spread from France. Nowadays, things like, for example, the swine flu pandemic in 2009, we have very high media coverage. In 2009, this induced more extreme reactions to the pandemic globally, including a mass slaughtering of pigs in Egypt, Asian bans on pork imports from certain countries, and mass production, stockpiling, and distribution of antivirals and vaccines. This high media coverage caused high anxiety as well in many individuals in response. This, however, did not mean that prevention recommendations were followed, since some believed that a lot of this was exaggerated coverage. Effects of influenza pandemics can be far and wide. It can have devastating effects on global economies and healthcare, along with some positive changes. Some of the negatives, aside from the most obvious, the high rate of death, include strain on resources such as healthcare, public funds, vaccines, etc. Decrease in public spending due to anxiety or business closures. Some of the positives, especially of the 1918 flu pandemic, include that influenza cases became ones that were reported to public health for the first time. This helped us track and confirm epidemic or pandemics of influenza in the future so that we can prepare and prevent further spread. This helped us learn from previous pandemics and reduce mortality via developments of vaccines and other prevention methods.